AACN realized that moral distress is being experienced by critical care nurses everywhere. And even before the pandemic, a lot of nurses were leaving the profession due to experiencing moral distress. And so in 2019, AACN convened a work group to explore the concept of moral distress and create a tool that we would like to share with you today. The first step for mitigating moral distress is really recognizing when a situation has the potential for moral distress to occur, or that moral distress is actually occurring. A lot of times people just don't know what they're feeling. They're experiencing all of those symptoms, but they can't put a name to it. Or they just assume that they're feeling burned out, when in fact, it's not that at all. It's moral distress. So to actually recognize that you have moral distress, it's important to use a tool to assess it. And there's a couple of tools that we can use. The first tool is the moral distress thermometer that's pictured here on the slide. This was created by Dr. Lucia Wolschel. And what we like about this tool is that it very efficiently and effectively measures moral distress in a timely way. It's a reliable and valid tool. And what you do is you circle the number on the scale of 0 to 10 that best describes how have you been feeling over the past week, including today at work. 0 is none. And you can see as the red of the thermometer increases, so does moral distress. So perhaps you're at a 4, that you're feeling uncomfortable, but you really aren't sure what's going on. Or maybe you're at a 6 and you're having nurse mares. Your neck is in knots. You're having GI distress. And then worst possible, these are people that probably have already left the profession. What's great about this tool is you can just use it right in the moment, right? There is another tool, the moral distress scale. And the original scale, as I said, was created by Dr. Corley and then revised by Dr. Hamrick in 2012. Most recently, Dr. Hamrick, as well as other researchers, created or revised the moral distress scale to create the moral distress scale for healthcare professionals, or the MMDHP. This is also a great tool to measure your moral distress. It is in the public domain for access so that you can download it and use it within your unit. It's a 27-item scale, and it's usable by all healthcare providers in adult and pediatric settings, as well as acute and long-term care settings. It is a reliable and valid tool, and again, just very, very useful. When we convened the work group, one of the work products of the work group was to create a tool to help people recognize and address their moral distress. And so I would like to share the tool with you that you can find on the AACN website. It's free to download, and it's located in clinical resources. There is a moral distress tab there, or you can find it through the search function on the website. This is the first page of the tool. And as I discussed, the tool is intended to help nurses recognize and mitigate moral distress. The first page of the tool goes back to the definitions that I just shared with you. How do you identify what it is you're feeling? To help you differentiate between moral distress, burnout, and compassion fatigue, we've listed the most common definitions for those here on this page. Then, as I said earlier, your next step is to assess your level of moral distress. Dr. Wolschel graciously allowed AACN to use the moral distress thermometer and to put the tool in our moral distress guide for you. She is a member of AACN and also consulted with the work group in the development of this tool for you. As you are assessing the level of moral distress, we've put the symptoms that you might be experiencing to the right that will help you decide, are you a 4? Are you a 6? Are you a 0? And then it's important to identify the causes and the constraints. And we've listed what I previously discussed here, the self causes, the unit causes, and the organizational causes. Lastly, the tool helps you select resources that can help. And again, we put our resources into the same categories. What can I as a nurse do for myself? What can I do to help mitigate moral distress? As a unit, what if we want to take this on as a unit project? What could we do as a unit? And then organizationally, what could an organization do to help mitigate or identify moral distress? The last page of the tool is intentionally blank. And this is a worksheet that you can print out to use for yourself, or for your unit to strategize ideas, to have people identify resources or strategies that they would like to do.